morning, everyone. I am Lorraine. I am from Hayat Institute. I'm a nurse by profession. I'm an EMT by practice, and Hayat Institute is a private business on the side. So thank you so much to Ms. Rachel and the organizing team for inviting us to give you some insights on infection prevention and control. I think nowadays, with the ongoing coronavirus, we really need to protect ourselves and make sure that we are safe. Sometimes there are viruses going on around us and we don't know where they're coming from. What we're going to do today is to understand what are infections, what are viruses, where do they come from, and how do they infect us. If we know how they infect us, we will know how to get rid of them. They actually say that infectious diseases such as HIV or influenza spread from one person to the other. However, how they spread, there's a difference. If it's HIV, there's a difference of how it spreads from person to person rather than influenza or your regularly known flu. Infection prevention and infection control are relative terms. And through this entire course, we'll be talking about infection prevention. It will be routinely used rather than the slightly older and more restricted term of infection control. Infection prevention covers all the activities to protect people from getting an infection. For example, it prevents an infection from occurring in general. It also includes all attempts to control or to limit an infection outbreak more than one case with the same causative organism and limit its spread. An infection actually is the presence and multiplication of microorganisms in a tissue or a host. Infections can be localized or can affect the whole body. When we say host, we're talking about where the infection actually grows. We're talking about where does it stay. And when we say localized, we mean to say it can either be to just a certain part of our body or the entire part of the body. Symptoms may not always be noticeable. Therefore, never assume that someone is not carrying an infection just because they don't have a symptom. What do you mean by symptom? Symptoms or signs can either be fever, sweating, pain, or inflammation. But remember, it doesn't mean that when people do not have these symptoms that they are free of infection. So there are some people who might be carrying an infection that is still not presenting signs and symptoms such as fever, sweating, pain, or inflammation. What you see now in the screen is a diagram of what we call your chain of infection. When we say chain of infection, if you are going to look into the circle, we'll start from the top. It says causative agent. When we say causative agent, we're talking about the certain organism that causes the infection, such as your Clostridium, your norovirus, your influenza, or what we are facing right now, your coronavirus. They are the cause. They are the organism. But this organism do not hang in the air. This organism goes, if you're going to go clockwise to the yellow box, we have what you call your reservoir. Your reservoir is where these infections, these organisms, these viruses live. So just like any individual, for us, we need to have a home. The same goes for infections or viruses or organisms. They do have a host or a reservoir or a source. So what are those? It can be humans, it can be animals, it can be environmental surfaces, it can be equipments, it can even be food or water. So now we have identified the organism. Then we know that the organism lives in a certain source or in a certain home. From this home or from this source or from this reservoir, there is a way for this organism to get out of that source or get away from the body before it goes to somebody else. Now, how can these organisms leave our body? It can get out of our body via feces, urine, wound drainage such as blood, pus, vomit, sneeze. Like for example, nowadays with the coronavirus, it can be transmitted via the sneeze. It can be transmitted via coughing or our body fluids that we can transmit via our mouth or our nose. So now we know the organism, we know where they live, we know how they're going to leave a person's body. Now we have what you call mode of transmission. Now they left the person's body, they need to be transmitted to another person's body. How do they get transferred? We get it via contact, such as our hands. That's why wearing of gloves is very important if you know that the other person is infected. Now, the person just sneezed and he touched his nose. And the secretions from his nose transferred to his hands. And here you come, you shook that person's hands and then you touch your nose. That's how it's transmitted. Or, the object was sneezed upon, and in that object, such as maybe, let us say, it's a pen, and the person sneezed and the secretions went into the pen, and you borrowed the pen, you hold it, and then you drop the pen and hold your face or hold your mouth. It can be a way to transmit as well. That's what you call contact via equipment. It can also be droplet infection. That's the reason why we wear masks, because if the person in front of us is having a shower when they're talking and they are carrying infections, we will not get infected from the droplets, or we will not get infected from the sneeze or the droplets that's coming from the nose. It can also be airborne. And this is a little bit more difficult for us to avoid. That's why wearing of the mask in a pandemic like we do have right now is a must, because we don't want to catch what might be getting to us from the air in itself. And of course, we also have a way of getting infections or organisms via food, such as salmonella. For example, we've eaten a raw food and it has already salmonella in it, and it's going to cause us diarrhea, abdominal upset, and such. So we've identified the organism, we've identified the source of the organism, where it's living, how it's getting out of the body, and how it can be transmitted. Now let us say the source of the organism is my body, it came out of my body, and now we talk about portal of entry. When you say portal of entry, how does it get to you? How do you get infected? How it enters your body rather. So it can get into the body via the break in your skin or wound, mucous membranes such as mouth, ears, nose, or via inhalation, just simply by breathing it for airborne organisms. And who are the person at risk? These are the susceptible people. If you have noticed, when we face a period of lockdown and the slow phase of opening the country slowly, we did have restrictions. Children under 12 and elderlies more than 60 are not yet advised, as per last week, to get out of their homes. It was just recently that they were allowed. Why? Because the very young and the very old are what we call the most susceptible risk, the most susceptible people who are going to be open to infections, the very young and the very old, or those what you say immunocompromised. What do you mean by immunocompromised? That their body is not fighting infections very well. Who are they? People who have chronic diseases such as hypertension, diabetes, people who are having chemotherapy, people who have been previously chronically sick and having long-term diseases, or are actually taking medications for chronic diseases. The government of the UAE have recently passed a decree during the time of the coronavirus that people who are chronically ill cannot serve as a frontliner. For the very main reason that if you are a susceptible person, you're a person at risk, they're not going to allow you to be on the front line. So this is the entire cycle. We have to know the organism. We have to know the source of the organism or the reservoir. We have to understand how it gets out from the source. We have to understand how it's transmitted, how it gets out. How it transfers to you, how it gets into your body. And who are these people who are at great risk? This is the entire cycle. As we go along, we are going to frequently come back to this cycle to understand how do we break them? How do we stop it? How do we make sure it doesn't transfer from person to person? You might say, I am safe, I'm in the workplace, I might not be facing this problem. But bear in mind that there are sources of infection in the workplace in itself, such as a person who has already been colonized or infected, including visitors and individuals. Yes, I know that now the country has opened up businesses and even institutions such as a training institute for us. However, we have to make sure that we check a person's temperature, make sure that they're wearing the proper equipment such as the mask, the gloves, and we provide all the time a facility for them to disinfect themselves, such as having sanitizers at least every 2 meters and maintaining social distancing every 2 meters. Why? Because in our own workplace, humans, us, we can be the first source of infection. We may not, remember as we mentioned in the first slide, it doesn't mean that you do not have a symptom that you are free of infection. It doesn't mean you don't have fever, you don't have an inflammation, that you are free of infection. So do not discount that fact. Animals also, particularly in animal breeding places, they can be a source of infection as well. Contaminated surfaces such as the environment or the equipment. That's why in a frequently visiting place wherein we are entertaining people coming in and out, such as banks, we have to make sure that the chairs, the desk will be properly cleaned every turnover of visitors that we are having. There is a way for us to make sure that surfaces will be cleaned, will be free of infection. And of course, in some areas of the world, there are also contaminated water supply that can be a source of an infection. So all of this can be present in our workplace or can be present even in our home. So we have to make sure that we know where these infections might be coming from. Now, as I mentioned earlier, when we understand the chain of infection, we can break it. We can make sure that this infection will not transfer from one person to the other. The chain may be broken at one or more points to stop the spread of infectious disease. It can be from the causative agent, it can be from the reservoir, it can be from the portal of exit, it can be from the mode of transmission, it can be from portal of entry, and it can be from susceptible host. So in any of this cycle, we can actually break it. You might be asking me, Lorraine, how? Here comes again the diagram that I've presented to you earlier. But now, we will see above every cycle of it, the term, how do we control them? Causative agent or the pathogenic organism. How do we control them? We can try to reduce incidence of the disease or eliminate the organism via immunization. We already have what you call the flu vaccine. However, we have not yet developed a vaccine against coronavirus in itself. But if a vaccine is present, it can actually provide us our immunity for us not to get that disease or not to get that infection. That's why from the causative agent in itself, immunization is one of the best ways to control. If you're watching in the news, it's been up and down that they have been trying their very best to come up with a vaccine. Why? Because having a vaccine, meaning to say, we will be immunized. If we will be immunized, it will rapidly decline or even reach a point of eradicating the disease in itself. Now that's for your causative agent. We'll move on to your reservoir or to the source. How do we control this organism when they are inside their homes? Remember, their homes can be humans, can be animals, can be objects, equipments, surfaces. How do we control it? Let's eliminate the reservoir. Make sure that each one of us will have good hygiene practices. For equipments, for surfaces, we make sure that there is proper cleaning. For animal or rearing facilities such as breeding places, poultry houses, or where animals are being taken care of, there should be proper hygiene as well. There should also be a source isolation or a care worker exclusion. You might ask me, what's source isolation? You remember, it's a very recent occurrence for all of us. In the coronavirus period, if you are exposed to somebody who had turned out positive for coronavirus, they are expected to go on quarantine for 40 days. This is what we mean by source isolation. In that 14 days, this person who got in contact with another person who's positive to coronavirus has to be away from other people. It should be isolated, because this isolation would actually mean to lessen the chance of this person to spread it to other people. The source has to be away from the others. Now, we are able to control the causative agent via immunization, the reservoir by good hygiene practices, isolation, and care worker exclusion. How do we control its exit from our body? How do we make sure, for example, God forbid, I do have an infection right now, how do I stop it from leaving my body? I have to make sure that I have to reduce the chance of that organism to leave my body. Let's take flu. Maybe I'm having a flu, I was having fever, I was coughing, I'm having runny nose. How do I make sure that I do not infect somebody else, that it doesn't leave my body? I have to wear face mask, I have to wear dressings, and I have to maintain good hygiene. Whenever I sneeze, I have to wash my hands to make sure that if anyone touches me, I will not be able to transmit that. I have to keep the mask on so that when I sneeze or when I cough, I don't transfer that droplet from me to the other person. Now, that has been controlled. I'm aware I have the infection. I don't want that infection to leave my body. Now, how do I control the mode of transmission? Now, I'm working in Hayat. I'm in a Hayat Institute right now. Let us say this is a face-to-face class. And you guys are sitting in front of me. How do I stop the mode of transmission? I have to make sure that I keep hand hygiene and I don't touch any of you. I have to make sure that the room has been properly cleaned so that I will make sure that whatever droplets I have had inside the room, if you touch that area, you won't get infected. There should be general hygiene for everybody. And in terms of infections that is found in food, there should be proper food hygiene. Now, I have controlled it. I've made sure that the environment is free of the transmission. How do you make sure it doesn't get to you? How do you control the portal of entry? You now are the entry points because the infection is from me. That's my exit. Transmission is how do I transfer it to you, and how do you receive it is the portal of entry. How do you not receive it? Make sure that you also apply good hygiene practices. That's why hand washing, or alcohol rub is very important nowadays. You have to wear the mask correctly. You have to wear gloves correctly, not only to wear, you also have to know how to remove gloves correctly. So only when we wear and do it correctly, then we will be assured that we are going to be safe. Don't worry, because we will also be tackling today how to wear and to remove properly the gloves, how to wear masks, and how to do proper hand hygiene. We'll be taking it down one by one. And for the people at risk, make sure that you are going to stay in a protective isolation and always have adequate nutrition. In a period like now, the pandemic, this is not the perfect time to go on your low-carb diet or a ketogenic diet, because now we have to make sure that we are properly or adequately eating and having proper nutrition. We are taking our supplements, our vitamins, because maybe we're not too young and we're not too old, but it doesn't mean that we're not at risk. We are still, but maybe we're not the highest priority to be at risk. But it does not excuse us from taking care of ourselves. Good exercise, good sleep, adequate nutrition is a must for us not to get infected. So we tackled this same diagram as per its definition. We tackled this entire diagram, how to control every single part of it, because controlling every single part of it will actually mean that we can break that cycle. We will break that cycle and that infection will not transfer from you to me, or from me to you, or from me to the general public, or vice versa. Understanding this is very important for us at this very point in our era that we are living in with the coronavirus pandemic. Do we have a question so far? I'll take your silence as none, so let's move on. Okay, as we mentioned, the spread of infection moves on from the causative agent and resource, reservoir, the portal of exit of how it gets out from person to person, the spread of transmission, and in the spread of transmission, we need to understand what are the different spreads of infection. How can it happen? When we say airborne, we mean that it is via respiratory, cough, sneezing, anything from our upper respiratory. When we say fecal oral route, it is something that we have touched something from the feces side and we actually ate. So this is the fecal oral route. It goes back to hand hygiene. When we say contact, it means direct contact from person to person, may it be from touching, from kissing, or from hugging. These are direct contact. And when you say indirect contact, this means to say holding objects that has been infected from an infected person. So sharing of utensils or sharing of glasses, these are indirect contact. When you say parenteral route, this is from IV, intravenous. Blood and body fluids, may it be from an open wound, may it be from blood transmission, may it be from sexual contact. So these are body fluids and blood as well. Animals and insects, such as if you're familiar with dengue, malaria, this comes from insects that can bite us and they are carrying different forms of viruses which will lead to an infection in our body. The mode of transmission, to just define it in a clearer way, it can be direct or indirect. When we say direct, it is from the source to the victim with no objects at all involved. Such as, when a person sneezes or coughs, it is breathed out and then directly breathed in via the person's contaminated hands. That's why hand washing is a must. Hand washing is the golden escape to all the infections, not only to coronavirus. When we say indirect spread, we're talking about contaminated objects, such as your wound, contaminated toilets, contact to surfaces, contaminated food and water. So, when do we wash our hands? All the time. When you go to the toilet, after the toilet, wash your hands. When you enter when you enter the building and you have to hold the doorknob, you wash your hands. It's not about being paranoid, but the entire cycle of infection actually comes back to general hand hygiene. So may it be direct, may it be indirect, make sure that we maintain proper hygiene. So let's play a little game. When we say method of spread, how do we match it to the description? When we say respiratory, which among the definitions on the right side matches to it? What do you think? Sorry?
Droplet in air.
Thank you. Respiratory are droplets in air. When we say parenteral actually means to say a break into your skin. It has to have a break into your skin for that microorganism to get into you. When we say fecal oral, what do you mean? From the term oral itself, what does it take from us? It actually means ingestion. You have to take something for you to get infected. To actually elaborate that further, maybe we ate a food that is improperly prepared. The person who cooked it do not have a proper hygiene or food hygiene in preparing it. And the food became contaminated. And here you go, you actually ingested that food and you suddenly have stomach ache, stomach upset, which actually led to diarrhea, or maybe even dehydration later on. So that's your fecal oral. What about contagious? What do you mean by contagious? We have only 3 left: by insects, touch onto the skin, or a specialized form of spread.
Specialized form.
Yes, contagious, is a touch on your skin. It is transferable from person to person by touching on the person's skin. For example, skin diseases. Psoriasis is one example of skin disease. Psoriasis is being transferred by frequently touching on a person's skin, and if we do have a break in our skin and we touch ourselves, it can be transferred from one person to the other. Although it's not a very common thing that we will see from day to day, but yes, it can be contagious. What about sexually transmitted? Specialized form of contact or insects? Of course, it's going to be your specialized form of spread, of your contact spread. And vector, by vector in itself, the term means vector is an object or an insect of how it transfers from person to person. These are animals. May it be insects or may it be animals. These are vector-borne. Moving forward, when we say spread of infection, we have 2 elements. It is the portal of entry of how it enters you, and the susceptible host, or the people who are generally at risk of the infection. What makes people more likely to get an infection? As I mentioned earlier, the age actually plays a very important factor, such as the very old or the very young. That's why there was a directive for people who are over 60 and children below 12 were not allowed some 2 weeks back to get out of their houses or to visit public places because they are susceptible hosts. Their immune system will not be as strong as an average strong individual adult like us. Psychological and physiological well-being will also contribute to being likely to get an infection. If a person is highly stressed out, and if a person is psychologically bothered or is having a lot of things that he or she is thinking about, it can lead to your sleeplessness. It can lead to your depression. It can lead to you not even eating. Therefore, physiological and psychological well-being is not a very favorable factor for you to be healthy. It can lead to so many things, and eventually this so many things can lead you to be sick. So you are also likely to get an infection. Poor nutritional status on top of the stress is also another factor why you are about to get an infection. If you don't eat well, you don't take your supplements, you eat very less, or you're trying your very best to lose weight or go on radical diets, it will make you likely to get an infection. If you have an underlying disease, such as a chronic hypertension, chronic diabetes, positive for HIV, having hepatitis B, or any other chronic illness you are taking maintenance for, it actually makes you highly susceptible to get an infection. Why? Because already your body right now is fighting a different condition. Your body is already trying to fight your diabetes, is already trying to fight your hypertension, is already trying to fight the hepatitis infection in your body. So now, since you're already having an underlying disease, it makes you susceptible or likely to get an infection. A woman who's pregnant is also likely to get an infection. Why? Because she's no longer just protecting herself. It's no longer about being one person. This is now having you and an unborn child that you have to keep healthy. That's why the susceptibility of a pregnant woman is not just for one, but now for two, which makes the person likely to get an infection. People who are currently receiving medical intervention, who are those? For example, people who are having kidney problems, they need dialysis. Dialysis is regular cleansing of their blood because they're no longer able to urinate or to excrete dirt from their body via urination. So they are now regularly receiving medical intervention. They will be highly susceptible. Those people who are having cancer and they are regularly getting chemotherapy, they are now receiving medical intervention regularly, which makes them immunocompromised or likely to get an infection. All these factors actually makes us at risk of getting an infection. It doesn't mean as well that if you're not within the list, you're safe. We are all going to be safe if we employ proper hygienic practices at all times. Now question, true or false? Infections may spread directly or indirectly. True or false? Anyone? None? Didn't we mention that earlier? That is true. Infection is the presence of a multiplication of microorganisms in or on the host. It's another true factor. An infection might spread parenterally is passed from adult to the child. Remember, it's not specific only from adult to child. It can be adult to adult or anyone who have had skin-to-skin contact. An infection spread from wound dressing is a direct spread. When we say direct, it's from person to person without objects. So may to say this is false as well. Because a wound dressing is already a dressing on the wound in itself. It's not person to person, there is an object involved. And stress makes people more likely to get an infection. Alright, moving on. Let's talk about different infection prevention precautions. We talked a lot about the infection cycle in itself. From the cycle, how do we break it? Now, how do we prevent? What are the precautions that we need to take? Why the use of the mask? Why the use of the gloves? Why all this hand hygiene, hand washing, alcohol rub, or the use of our sanitizers? Let's understand that further. After this session, we will be able to list infection prevention precautions, describe why standard infection prevention are used, list the reasons for keeping our hands clean, describe how to wash your hands correctly, describe the areas of the hands most often missed during hand washing. So now we have again the same diagram we had earlier. Okay? This is just emphasizing to you how to control them. We mentioned it earlier. Immunization, good hand hygiene, cleaning, use of face masks, correct dressings, again hand hygiene, cleaning, good hygiene practices. If you will notice, hygiene is being mentioned all over because it is a way for us to control the spread of infection. Now, standard precautions is for everybody. We will be watching a video later on when we talk about the 5 moments of hand hygiene, how to wear personal protective equipment such as your mask, use of your gloves correctly, dispose and waste safely correctly, how to remove the gloves correctly, and how to dispose if you have any sharp objects correctly as well. Now, why is standard infection very vital to all of us? Infectious agents are potentially present in all our body surfaces. We don't see them. This is the hardest part. We don't know where they are. If it's something that we can see that we can just take away from us, it's very easy to combat it. But the problem is infectious agents are potentially present in our body and we just don't see it just like that. It's invisible to our naked eye. Precautions puts a barrier between the service provider and the individual, such as wearing the mask allows us to have a barrier between people who are infected for that infection to get out of their body, to be transmitted, and to enter our body. That's why precautions, using a barrier, is very important as well. Now, here's the thing. When and how to wear a medical mask. How to properly wear a mask, make sure that the white portion of the mask will be inside And the portion that is hardened and bending should be on our nose bridge with the blue color of the mask outside. So we're going to fit that bending side of the mask towards our nose bridge, and we are going to put the ear loops around our ears, and we're going to pull the lower part of the mask to cover all our chin bone. Make sure the entire time that you're wearing the mask that you do not touch the outside of the mask, because remember, people talk to you, people might be sneezing, there might be infection already on the surface of your mask, on the blue side. So when you touch the outside of the mask, make sure you wash your hands, or make sure that you are going to have an alcohol rub. In addition, every time your mask gets damp or wet, meaning to say it's time for you to change the mask. Mask should not be reused at all. And mask, once it is wet and once it is damp, sweaty, already has to be changed. But how do you properly remove a medical mask? Some of us touches the mask from outside on the blue part and then remove it. No. Make sure you do not touch the blue side of the mask. You just remove the loops around your ear and discard the mask blue face downwards. Why blue face downwards? To make sure that we do not touch the blue side of the mask. Alright, this video will be sent to you as well for further references from WHO at the end of this session. The second part is how we know how to wear gloves. Wearing a gloves can be done at any way that you want to do. Why? Because at that time, the gloves are still clean. But the problem now when you wear a gloves, you will touch different surfaces. You will touch doorknobs, you will touch elevator buttons, you will be touching your friend, you will be touching surfaces. How do you make sure that when you remove the gloves, you do not contaminate yourself? So when you remove the glove, you always treat the gloves as dirty because it is now dirty. You have touched several places. So right over left, left over right, it doesn't matter. But the first glove that you will remove, you will touch from the palm surface and pull that glove out. And from your other gloved hand, now you have a hand that do not wear a gloves. So you should not touch your clean hands outside of the gloves. You have to make sure that you're going to put the two fingers of your clean hands under the gloves, touching your skin. And from the inside, you're going to flip that gloves outward so that you don't touch this dirty side of the gloves. Why we keep our hands clean? So that the workplace environment, because the workplace environment is contaminated. Because all work involves our hands. Our hands can easily be contaminated. Hands can spread germs, and individuals can be vulnerable to infection. Our hands is the golden thing we have on a day-to-day basis. We touch everything with our hands, and we don't know what we're touching. And because we don't know what we're touching, we might be touching things that can infect us. We can already be touching the organisms or the viruses and spread it to ourselves. Or worse, from ourselves to spread it to other people. That's why we have to keep our hands healthy, clean at all times rather. Hand practices, minimize touching your hair, biting your nails, touching spots, touching your mouth, touching bin lids, or raw food. These sites may be contaminated by germs, therefore, wash your hands. Think about what you do and what you touch. Some video studies have shown people who frequently touch things unnecessarily. Sometimes when we're stressed in the office, we just juggle and play with the pens or with a squeegee ball that has been passed from one person to the other. And we don't know that even that squeegee ball is therapeutic for us because we're so stressed. It will release us of tension, but that squeegee ball can actually be contaminated. Optimize workflow by minimizing touch actions. Remember, the more you touch, the more likely you are going to cross-contaminate. I know, most of us, before the coronavirus, we have not thought that it's that easy to spread it. But then magic, it became a pandemic. It spreads just like that. So, what are the things that you have to ask yourself before hand washing? What am I about to do? What have I just done? What type of hand wash do I need to use? What product? How often do I need to do it? Is there a known infection present? How susceptible is the individual? Well, if you've come in contact with a person, even if you don't ask these questions, you just treat your hands as something that can touch infections and that can transfer infections. So might as well just do your hand washing. This is when the 4 moments of hand hygiene comes in. This is by WHO. If you're a healthcare provider, you have to wash your hands before touching a patient. You have to wash your hands before clean or antiseptic procedure, after body fluid exposure risk, after touching a patient, or after touching patient surroundings. Well, you don't need to be a medical practitioner to use this hand hygiene moments. Before you touch another person, wash your hands. Before you touch your child, your wife, your husband, or your aunt, your mother, wash your hands. Before you're going to go and clean, or rather, before you go to cook or do any procedure in the home, wash your hands. After you use the bathroom, wash your hands. After you touch maybe a patient or not a patient, wash your hands. After touching surroundings that you did not disinfect or foreign areas that you've come from outside and you've touched a lot of things, wash your hands. It doesn't have to be the 5 moments. It should just be always wash your hands. What are the 3 ways to effectively wash your hands? First, prepare. Remove all the jewelries that you do have. You don't need all of them because you don't need areas to be covering your hands. You want it free of all of these things. Wash and rinse your hands and then dry your hands either with paper towel or a dryer. The question is, in the preparation phase, remove and check the appropriate cleanser and towels are available. Remove your wristwatch or any jewelry you may have forgotten to remove before starting your work. Make sure that there is an appropriate disposal for you to dispose your hand towels. So everything in its proper place. How to wash your hands? This is another video of 9 steps again. First step is you're going to wash your hands, wet your hands, your wrist, and your forearms using running water. Apply around 3 ml to 5 ml of liquid soap. Produce a good rubbing on your palm with interlocking your fingers. This is now step 3. After doing that, you have to rub the palm of your hand, ensuring that the fingertips and the fingernails are clean. Ensure that the back of the hands and the wrist are cleaned. Rub your fingers, lock it, maintaining a good lather, and ensure your wrists are cleaned. Rinse the hands around using running water. Thoroughly dry your hands, your wrist, and your forearms using a paper towel or a hand dryer. Turn off the top using the paper towel. You should not, after you wash your hands, do not touch the sink or the top again. And dispose of the paper towel without touching the waste bin. Now your hands are clean, you should not be touching any other surfaces anymore. Usually, if you'll see at the diagram, yellow represents the most frequently missed areas of our hands. So in between our fingers are usually missed, and on the sides of our big fingers and our nails are usually missed. When we wash our hands, we wash the palms, but we forgot that in between the palms are curved areas that can be a place where your viruses might be staying, and our nails as well. Especially for ladies who are used to keep their nails long and also having a lot of jewelries all the time. So what about rubs, gels, antiseptics, and skincare? Of course, the more often we use the alcohol, the sprays, and disinfectants, it can also ruin our skin. So when decontaminating hands using an alcohol rub, hands should be free of dirt and organic material. The hand rub solution must come into contact with all surfaces of the hand. There must be rubbed together vigorously, paying attention to the tips of the fingers, the thumb, the areas between the fingers, and until the solution has evaporated and the hands are dry. So the same motion that we have done for hand washing with water, we should also rub the surfaces of our hand in between the fingers, the fingernails, the thumb, and at least our wrist, and let it dry. Alcohol hand-based rubs can be used between hand washing if hands are clean. They are not cleansers and they do not have an effect on organic material. They are ineffective against spores and less effective against some viruses. Yes, they can help you for some time, but alcohol-based rubs are not as effective as your hand washing. If hands are contaminated, they should be washed prior to using alcohol-based rubs. All surfaces of the hands must be covered, and alcohol rubs or gels must be allowed to dry on the skin prior to starting any other procedure. So when you put the alcohol, do not touch anything else. Let it dry first in your hands and then you can resume what you're doing. Alcohol-based rubs can cause skin irritation in some people. Depending on the formulation, it can also leave your hands sticky. And again, it does not replace hand washing. So do not overly rely on them. Okay? Hand washing, people who actually fail to wash their hands is the most common cause of healthcare acquired infections. We find it inexcusable that compliance with guidance on hand washing is so poor, and management and control of hospital acquired infections has to take action. This does not only apply to medical practitioners, it also applies to us. Having poor hand hygiene and failing to wash our hands, especially when it's soiled and you feel that it's dirty, is inexcusable. Remember, by following hand hygiene guidelines, you are not only protecting yourself, but you are also protecting the individual, your colleagues, and your family. By taking time to do the right thing in the right way would reduce the risk of spreading the infection. By doing this, you improve the outcome for you and the individuals around you. Let's keep the module. So how do we use the PPE or your personal protective equipment? The management and skills of the maintenance of equipment of infection control. How are these? When you say PPE, we're talking about personal protective equipment. In these days, we call them your gloves, your mask, or even your face shields. Wear PPE if identified on the risk assessment. Nowadays, risk assessment is very high for everyone. So to keep us all safe, wear the mask at all times. Some people opt to wear gloves and some people still opt to wear face shields. If you see any defect on your mask, on your face shield, if it is supplied by your facility, let them know so it can be replaced. Follow guidance for the use and the proper disposal. You don't leave your mask anywhere, you don't leave your gloves anywhere. There should be a proper disposal so these things do not contaminate other people or even people who are cleaning our buildings or our homes. Do not to use disposable PPE more than once. When we say disposable, we use it one time and once it's soiled, dirty, we replace it. It doesn't mean that you wear it for the entire day. Remember, when the mask is already damp or wet, you have to replace it. Follow hand washing routine and procedures at all times. For us in the medical field, it is our responsibility for the employers to provide the PPE on identified risk assessment. Ensure PPE provided is fit for the purpose and for everyone. Replace and replenish stocks as required, and provide guidance for its correct use and disposal at all times. Personal protective equipment, if there's no blood, there's no body fluid, and there's no infection in a regular, normal day, PPE will not be required. If there's blood, body fluids, low risk of splashing, infection, or risk of contaminating products, aprons and gloves are required. But if you have everything, body fluids, high risk of splashing, infection, contamination risk, aprons, gloves, eyes protection, or your face shields are required. So that's the reason why we are wearing all of these things right now. Your gloves is an optional PPE or personal protective equipment nowadays. However, what are the advantages of wearing gloves? It provides barrier protection. It can prevent transfer from you, who's the one wearing it, to the individual or to the food or back and forth. It may not reduce the need for hand decontamination. It does not substitute decontamination. The difference between gloves for cleaning, support of individuals, and aseptic procedures, there are different gloves that you're wearing. There are plastic gloves, there are vinyl gloves, there are medical gloves. However, there is no specified type of gloves that is mandated by the government for all of us to wear right now. If you choose to wear gloves, Make sure that you remember gloves do not replace hand washing. And that when the gloves are soiled, these gloves are considered dirty, your hands are dirty, you should not touch yourself. Because that gloves in itself can be a source of infection if we keep on touching ourselves or the individuals around us. So if you choose to wear gloves, remember to treat it like your hands, and it does not replace the contamination. Well, these are medical related stuff. I think I will just keep it now. It took more than an hour as promised, but it will be sent to you. This is generally for staffs or for people who are working in a medical facility. Okay? Gloves and aprons are single use. It must be of the suitable size. Wear when there is a risk of being contaminated. Gloves do not substitute hand washing. Latex allergy also may be an issue, so we can change the different gloves if we choose to wear gloves. So gloves should be removed correctly to avoid cross-contamination. The video of how to remove gloves will also be sent to you to be guided accordingly. Single-use items are single-use. You cannot reuse them. Do not wear the mask you used yesterday and wear it again today, or the same as for the gloves. Cleaning and disinfection. In the diagram, you will see what cleaning and disinfecting means. Cleaning is just removing the large and dirt particles. It's just taking it away. But disinfecting is actually not just focusing on the dirt and the particles. Disinfecting is focusing on the microorganisms that are causing the infection for us. So regular cleaning of our offices nowadays are not enough. Regular disinfection has to be done. If you can have a disinfection orientation within the company in itself and learn how to properly disinfect, or you can get a third-party company to do the disinfection regularly, especially nowadays.